Welcome back, ladies and gentlemen, to Doctors Go Live. I am your host, Nina, and today we are talking about diabetes and its link to heart diseases. Now, people with diabetes are more likely to develop heart disease. In fact, they are more likely to have certain risk factors such as high blood pressure or high cholesterol that increases their chances of having a heart attack or a stroke. Okay, so to help you be informed and reduce your risk of a heart attack or stroke, we've got you our expert from Columbia Asia Hospital, Petaling Jaya. He is none other than interventional cardiologist and consultant internal medicine physician, Dr. Richard Chan. Okay. This is what is happening today. In the meantime, thank you so much for joining us. We are talking about diabetes and its link to heart disease. If you share this video out, we have a very special treat for you. You get to take part in our Doctors Go Live quiz happening right after the Q&A, where a backpack, a flask bottle, as well as an umbrella are all up for grabs, and it is raining right now, so we definitely need an umbrella. Okay, all this happening right here on Doctors Go Live with me, Nina, and today's special guest, consultant, interventional cardiologist, and consultant internal medicine physician from Columbia Asia Hospital, Petaling Jaya, Dr. Richard Chan. Now, you've probably heard that people with diabetes are at risk for multiple health problems, right? Complications, and this includes cardiovascular disease. In fact, statistics show that the majority of people with type 2 diabetes will eventually develop cardiovascular disease, increasing their chances of having a heart attack or stroke. Now, what is the link between diabetes, heart disease, and stroke? How can you lower your chances of a heart attack if you have diabetes? And what are some do's and don'ts and tips for people suffering from this and for caregivers? All this is happening right now. So if you know somebody who is suffering from this, or if you think this is such an important topic that's going to make a difference to somebody out there, please do share this video on your social media. Tag your friends, follow us on social media, because this episode is definitely going to help make a difference in their lives today. All right. So in the meantime, let's take a look at this video.
You have probably heard that people with diabetes have multiple health complications, which includes cardiovascular diseases. In fact, statistics have shown that the majority of people with diabetes will eventually go on to have cardiovascular disease, thus increasing their chances of getting heart attacks and a stroke. Hi, I'm Dr. Richard, consultant cardiologist, Columbia Asia Hospital, Petaling Jaya, and I'll be talking about all this and more on Doctors Go Live on the 10th of November, which is a Wednesday, at 3 p.m. So do mark it down on your calendars, and I'll see you then.
Welcome back, Doctor. Thank you so much for joining us. We're so honored to have you here. Okay, for those of you who are just joining us today, we are talking about diabetes and its link to heart disease. To help you be informed and reduce your risk of a heart attack or stroke, we've got you our expert from Columbia Asia Hospital, Petaling Jaya. He is none other than interventional cardiologist and consultant internal medicine physician, Dr. Richard Chan. Dr. Richard, thank you for joining us.
My pleasure. Hi, Nina. Nice meeting you.
Nice meeting you too. Now, also, just to share with you guys again, right at the end of the show, you definitely want to enter our Doctors Go Live quiz, where you stand a chance to win a backpack, a flask bottle, and an umbrella. So do pay attention to what Dr. Chan has to say. Now, if you have any questions as well, feel free to ask us throughout the show. We will address them right at the end. So, Dr. Richard, first things first, can you share with us a little bit about yourself and what is it that you do?
I'm a cardiologist and I see a wide variety of heart diseases, which includes heart failures, valvular heart disease, palpitations, and of course, a heart attacks and blocked coronary blood vessels. So my area of interest is in interventional cardiology and doing things like angioplasties, which means opening up a blocked vessels with balloons or stents. And I like doing complex cases. Yeah.
Right. Okay. Could you share with us how did you start? How did you start at getting into this? What was your interest? And what do you mean by interventional? Cardiologist, right? Yeah, interventional.
Oh yeah, okay. I've always been interested in the heart for a few reasons. Of course, for physical reasons, the heart is actually a very important structure in our human bodies. Without the heart, everything else fails within seconds. So of course, in the heart also there are a lot of things going on. It can be the muscles, the blood vessels, the electrical systems, and the valves in the heart. So the other aspect that I'm interested in the heart is the emotional part of the heart as well. And of course, me being a hands-on person, I like doing things, and being an interventional cardiologist just ticks all the boxes.
Wow. Okay, so that's the emotional part as well. Okay, sounds fantastic. Let's get straight into this then. How is diabetes linked to heart disease or even stroke? I mean, why why does this happen?
Okay, diabetes is a condition where it just kills a lot of organs in our bodies. And how does it do that? Basically, it just messes around with the structure of the blood vessels. Okay, so the blood vessels that supplies blood into your heart and also the brain, all these blood vessels. So when diabetes damages these blood vessels, it tends to cause some narrowing of these blood vessels. Okay, so the narrowing of the blood vessels are the thing that gives rise to all these problems. Like if the vessels is completely blocked in a heart, we call it a heart attack. And if the vessel to the brain is completely blocked, we call it a brain attack, which in layman's term is called a stroke.
Wow. Okay, so is it? Would you say that it works the other way around as well? If you have a heart disease, does that affect your chances of getting diabetes? Just wondering.
Uh, no, not really. Usually,
Okay.
the diabetes is the thing that causes heart disease and strokes, not the other way around. Yeah.
Okay, and it's not just heart disease and stroke, right? Does it cause other diseases as well
Yes,
when you
like I
have
said, because it
diabetes?
just damages the blood vessels in your
Mm.
body. So if a patient with diabetes can have complications from getting eye problems to getting a legs amputation, they've got a higher risk of getting an infection, and of course they're very prone to getting kidney failures as well. Yep,
Wow. Okay, so this is a major problem in diabetes.
it
Okay,
definitely is. Yes.
okay. So what are the causes of it? Is it food or is it genetics or is it something else? How does one get this?
I think you've mentioned those causes. Genetics is number one.
Mm-hmm.
Usually my patients who have got diabetes, they always say that they are not the only one in the family who has that. Their siblings, their parents have that as well. So it's something that can be passed on from generations. And of course, the other thing is dieting as well. And people with very high, sugar intake, those people who have got a sweet tooth, they are more prone to getting diabetes as well.
Right. So, how big does genetics play in this? When you say a lot of, it's mostly genetics. How many percent would you say?
Genetics, there are a few types of diabetes, okay, namely type 1 and type 2 diabetes.
Mm-hmm.
The type 1 diabetes for genetics, it is definitely, that's got a stronger association with genetics. So type 1 diabetes usually happens among younger people.
Mm-hmm.
So they can get diabetes in their childhood or in their teens. All right, so these are called type 1 diabetes. And type 1 diabetes is because of the autoimmune disease, whereby the own body cells attack the pancreas that produces insulin. So there will be a shortage of insulin production in the body and hence getting diabetes, right? So whereas
Mm-hmm.
type 2 diabetes is more of acquired and it's linked to obesity as well and insulin insensitivity. So meaning your pancreas is producing normal amount of insulin, but it's just that your body is very insensitive towards this insulin. So hence the
Mm-hmm.
pancreas will work even harder to produce more and more insulin, and in the end, the pancreas fails, and that causes diabetes.
Right. Okay, that makes a lot of sense then. Then basically, who is at risk then, would you say?
Um, who is at risk of diabetes?
Mm-hmm.
Basically, people with very poor diet control, like I said,
Mm.
they take high amount of sugars. You can. I've got a friend who used to drink Coke as his
I was
water.
about to mention Coke. Coke every day?
Yes, yes. So that is crazy, and of course, he ended up having diabetes. Yeah,
Mm-hmm.
so that is one thing. So of course, people with obesity and there is a condition called metabolic syndrome, whereby it's
Mm-hmm.
a cluster of conditions, or whereby a patient would have diabetes, obesity, or central obesity, especially putting on a lot
Mm-hmm.
of fat around the waist area. They've got high cholesterol levels, high triglyceride levels. they have got gout, and all this constellation equates to having a metabolic syndrome. So these type of people will tend to get diabetes as well.
Wow. Okay. So definitely it is a diet thing, not just a genetic thing that you can
Yes,
inherit.
yes,
Yeah.
yes.
In terms of how common is it in recent years, have the numbers increased? And would you say that Malaysia is high on the, on the list of people who are suffering from diabetes?
Well, I wouldn't say Malaysia is one of the high, but in fact, Malaysia wins the award of being the country that has got the highest incidence of diabetes in Asia. All right.
Wow. Okay. That's not a
Yeah.
good award to win, right?
That is definitely not, but we are well known to
Mhm.
have very sweet people around. Yep.
Right. Okay.
And when you were asking me about whether it's getting worse, so that there was
Yes.
a national health registry whereby they found in 2015 around 13% of population in Malaysia above the age of 30 suffers from diabetes. All right. But in the 2019 data, from the 13%, the incidents have shot up to 18%. So it's a very good 5% increment over the past 4 years.
Wow. Okay. And the other countries, just comparing
Um,
Malaysia, would you happen to know the data? No.
I'm not sure about the other countries, but the incidence is definitely less than that, probably around 10 to 20%.
Wow. Okay.
Yeah,
So
but Malaysia
definitely.
is definitely around 18 to 20%. So 20% equates to one in five people having diabetes above the age of 30. So that is actually quite significant. Yeah,
It is because it's just above the age of 30. That's quite a huge number, isn't it?
it is. Yeah.
Okay. So what is it that a lot of people don't know or don't understand about this?
A lot of people don't understand the severity of diabetes because,
Hmm.
unlike other diseases or illnesses, diabetes tends to be asymptomatic. A lot of people, if they don't do regular blood checks and they have no idea how their sugars are like, they don't feel anything actually. Yeah. But once they feel something, probably it is a bit too late. All right. I always call it a silent killer because it
Hmm.
slowly eats away your organs and everything. And by the time you feel something, that's probably a bit too late to reverse the effect of diabetes in the body.
Wow. So if that's the case, what is it that people should do then? Since it's a silent killer, and by the time you figure it out, it's a bit too late. What can we do to prevent this or to create awareness on this?
Basically, regular blood checks,
Mm-hmm.
especially checking your sugar levels. So that would be a great way to start off with. But of course, diabetes also presents in with certain symptoms. For example, some people might feel thirsty and they need to drink water all the time, or they feel like they need to go to the toilet to pee all the time, or they feel they're hungry all the time, or they're putting on too much weight out of a sudden. So all these could be symptoms of diabetes as well.
Mm-hmm. By then, is that too late or it's still
Uh,
okay?
it's never too late to check. But of course, if you have all these warning signs and if you don't go and see the doctor, you're just probably asking for trouble.
Okay, got it. When do you recommend people to do like blood checks, blood tests? Like how
All right.
old and how often?
Ideally, above the age of 30, um, I think people above the age of 30 should have their blood tests annually, once a year.
Hmm.
Yeah,
Wow. I mean, we always think that 30 years old, yeah, we're fine. We'll probably do the yearly blood check at 40. So
yeah.
now it's changed, right? So if you're 30 years old, get your blood test done every year. Make sure you stay away from Coke if you're drinking it every day as well. Kind of thing. Okay, cool. Moving along, we spoke about the different types of diabetes, right? Type 1 and type 2. Does one sort of low affect you having a heart attack or higher the chances of you having a heart attack compared to the other one? Just wondering.
Um, Not really. I mean, if you have diabetes, that itself is a risk factor to get heart disease or stroke or cardiovascular, what we put it.
Mm-hmm.
Um, in fact, if you have type 1 diabetes, which usually presents at a younger age, like I said just now,
Mm-hmm.
patients will tend to have heart diseases or heart attacks at a very much earlier age. In fact, I remember I saw a lady who was only 26 years old. She was
Mm-hmm.
an obese lady with diabetes, but she has been having diabetes since childhood. So when she came in with a massive heart attack, and her blood vessels, when we did the angiogram, was really horrendous. So we had to put in multiple stents for her. Yeah.
Okay. And then there's actually are there cases where pregnant women they suddenly their blood sugar kind of shoots up during pregnancy? Just wondering.
Yeah, yeah, of course. Pregnancy is one of the risk factors to get diabetes, but it's what we call gestational diabetes, means diabetes when you're acquired during pregnancy. But once the pregnancy is over, their blood sugar usually returns back to their normal state. But
Mm-hmm.
having said so, those patients with gestational diabetes, they are more likely to get diabetes later on in their life.
Mm-hmm. Okay, got it, got it. Let's talk about treatment then, Doc. For those who have diabetes or taking care of people with it, is there a treatment for it or a cure, or do we have to live with it once we know
Um,
we have diabetes?
I think the first step that people should do is actually to accept the fact that they indeed have diabetes. A lot of people want to shake off this idea that I don't have diabetes, I'm not going to go on lifelong medication. But what I usually tell patients is that diabetes is a progressive disease, meaning it only gets worse. All right, it doesn't get better. All right. So when the disease just gets worse and worse, the only way to sort it out is by taking medications, right? So there are a few
Mm-hmm.
types of medications. There's oral medication, and of course, when the oral medications fail, we move on to another level of injecting insulin into the patient.
Right. Okay. So it are you saying
Wait,
that
sorry. Yeah, when
it's
you say when you
progressive?
ask me,
Yeah.
yeah, is there a cure for diabetes? Sadly, no, there's no cure for diabetes. Yeah, but if
Wow.
we keep the sugar low enough all the time and be strict with our diet control and be compliant with our medication, uh, all these complications will have a very low risk of developing further in future.
Wow. Okay. Let's talk about that then. Managing, diabetes. So first things first, I thought that you could go back to normal, but apparently you can't, right?
Mhm.
It's progressive. If you take care of your diet, is it still progressive or it's maintainable? I guess that's the word.
Well, if you take care of your diet, I mean, if you have diabetes already, right? I'll say, if you have diabetes already,
Mm-hmm.
even if you take care of your diet, your diabetes is not going to reverse back to a non-diabetic level as
Wow.
before.
Okay.
Yeah.
Mm-hmm.
So once you get diabetes, it's only a one-way ticket. It will just get worse.
Get
But
worse.
the question is whether or not we want to make it get worse at an exponential rate or at a slower rate. So what we can do
Right.
is to make things better by slowing down the rate of progression of diabetes by controlling the diet and by taking medications.
Right. Okay.
Yeah.
Okay. So maybe you can share with us. Let's say a patient finally finds out that they are suffering from not heart, sorry, diabetes. What's usually the steps that they go through or that you suggest for them? How does it? How does treatment look like?
Okay. Treatment consists of a few factors, and it's not just medications. Of course, number one, we have to diagnose diabetes by doing blood tests. And sometimes we need more than one blood test to really confirm the status of a diabetic patient. All right.
Mm-hmm.
So once diabetes is already established, and we usually tell patients that, yes, indeed, unfortunately, you have diabetes, and you have to read around diabetes and know what are the complications of diabetes so that you'll be more motivated to actually get your sugars down. And basically, it's just a modification of lifestyle. If a patient is, like I said, has a sweet tooth and taking sweets a lot and taking a lot of carbohydrate, especially rice and noodles and everything, um, the progression of diabetes will be much worse than one who doesn't. Okay, so what I
Right.
usually tell them is cut down, control your diet. I'm not asking you to stop completely whatever you're doing,
Mm-hmm.
but cut down on your sugar intake. And of course, the other component is by doing regular exercise, because by exercising, it brings the sugar level down as well.
Right. Okay. So exercising and taking care of the food is what matters most. Yeah.
Yeah, yeah.
Okay. And I guess what's the biggest mistake that a lot of people make when it comes to diabetes and heart? Just wondering.
Complacency, basically. Yeah. Um, I think education is very important for patients. I think more than 50% of the battle can be won by educating a patient regarding the issues of diabetes. Because a lot of them, like I said, they just treat diabetes as nothing. It's not something that they feel while they have a fever. It's not something that they feel if they already had a stroke, you know. But diabetes is such a silent disease that patients will just feel happy and healthy all the time. And if they don't know the consequences of it, they will continue doing what they have been doing, which is unhealthy diet and not regular exercise and kind of thing. So I think that is the biggest mistake that patients always underestimate the severity of diabetes. I
Also,
always tell them it's like a cancer. Diabetes is a slow killer, you know.
uh-huh,
But the
yeah,
good thing about diabetes is like it's a cancer that be um, uh,
reversed.
not reversed, but can be controlled. You see, a lot of
I
cancers cannot
see.
be controlled. You know, it just progresses and
Mm.
patients die from it. But diabetes, the good thing is there are medications and there are ways to control it. Yeah.
Right. Okay. I mean, it's exactly like what you say. It sounds like it's as dangerous and as serious as cancer, and yet you know, people don't really take it seriously. Why do you think that is so?
Like I said, because they don't feel anything.
Okay. But in terms of awareness, even out there, when you hear cancer, people are like, ooh, cancer, you know. But then with diabetes, okay, most of the time. What is happening? You know what I mean? Uh,
Yeah.
is it the awareness in people out there?
Um, I think because patients are just number one, they don't realize that they don't like knowing that they have a disease to start off with. And
Mm-hmm.
I always have a hard time telling them that they have diabetes, and they will tell you, okay, okay, I have diabetes, you know. But when you see them again the next round, they will tell you, oh, doctor, I haven't been taking my medications because I feel fine, you know. So it can't, they just can't drill into their heads that they have diabetes. So they are always in a state of denial.
Right. Okay, I have a question. So this would be the emotional part of the disease, correct?
Yep.
Yeah. So in all most of your patients, how many percent actually are not able to deal or accept the fact that they have diabetes or the
I
severity
wouldn't,
of it?
yeah, I wouldn't say many, perhaps around 10 to 20% of them.
10 to
Yeah.
20%. Uh-huh.
Yeah. Yeah.
And does that impact their recovery compared to the ones who quickly accept it?
Most definitely, yes. Yeah.
Mm.
Those who cannot accept it will just go on with what they have been doing all this while. You know, if they have been drinking 5 cans of Coke, they will still continue to drink 5 cans of Coke every day. Yeah. But those who have accepted and understood the severity of diabetes, they will really heed my advice and cut down on all the unhealthy lifestyle that they have been doing. Yeah.
Okay. What are some of the cases that you consider is like a breakthrough for you or like a super successful case for you where the patients actually listen and make fantastic recovery? Would love to hear some
All
of
right.
your experiences.
Those patients, especially who have diabetes because it is an acquired disease,
Mm-hmm.
so they have diabetes because of their high sugar level intake. And when they are found to be diabetic and they are told that they are diabetic, so aggressive therapy has been instituted to them, including dietary control, dietary
Mm-hmm.
advice, and medications. So, you know, their levels of sugar would have gone from 10 to 6.5, you know, which is actually a big deal. So
Mm-hmm.
if they control their sugar level below the level of 7, or what we call HbA1c, the
Mm-hmm.
chances of them developing all these complications will be quite low. Yeah.
Okay. And when we
So those
say
are
like
very good success stories. Yeah, that I've had.
how many percent of your patients have those kind of success? Just wondering.
Probably 60-70%, I would say.
That's very good, right? 60,
Yeah,
70.
yeah,
Yeah.
yeah.
Okay. And when we talk about what is the major challenge for okay, so if that is 60 to 70, so there's another 30%
Mm,
who's not getting such success results. What are some of
mm.
the worst cases that you've had to deal with? Just wondering.
Diabetes is one of the risk factors for cardiovascular disease. There are other as bad risk factors as diabetes, such as smoking.
Mm-hmm.
So if a patient who has diabetes and they are heavy smokers as well,
Smoker.
and they are not compliant to their medications, so they have got double, triple fold of increased risk of getting heart attacks and stroke. So I've seen patients who have uncontrolled diabetes and they're still smoking, their lungs out, they will usually come in with heart attacks. And usually when we do an angiogram for them, we see that the blood vessels are not only blocked in certain single vessel, but in
Mm-hmm.
three vessels and in multiple segments as well. So those are quite bad shape. And it's the same thing. If your blood vessels in your heart is that bad, the blood vessels around in your body will be as bad as well. Yeah.
Right. Okay. Wow. Okay. So that's what happens, obviously, because that's a worst case scenario, right? In terms of when we talk about the patients who follow your advice in terms of food, I would love to know this. What is the biggest challenge for them to stick to, the recommended, whether it's diet or taking their meds? What is their biggest challenge?
Surprisingly, a lot of them actually have no problems cutting their sugars. So a lot of them tell me, Doctor, I've stopped my Coke, I've stopped teh tarik, I've stopped 3-in-1 coffee, but I still cannot cut down on my carbohydrate. So those people who are carb people like me as well, I love carbs. So people
Mm-hmm.
like us,
We're
we find it very
Asians. I think we
difficult.
love carbs, right?
Yes, exactly. And that is probably why our diabetes rate has gone up so high in
Uh-huh.
Asia.
Mm-hmm.
So carbohydrate, people just love it and they think, I'm not taking anything sweet, it's just rice. But they don't realize that rice in the body, it becomes sugar as well. Yeah.
Okay. So it's basically the sugar. What would be your advice to cut down on sugar and stuff like that? Are there alternatives? Because a lot of people talk about alternatives. Are all those alternatives equally bad? Just wondering.
All right. Alternatives means artificial sugar, right?
There are other types of sugar which are fruit sugar, dates, substitute, but I don't know if that's still
Mhm.
considered sugar.
Yeah, those are considered sugars as well.
So
Yeah.
it's the
But the
same.
other
Okay.
thing, yeah, it's just the same thing. But artificial sugar is a little bit different. I
Mhm.
know we have things like Diet Coke and Diet Pepsi and all. Of course, there are no long-term studies regarding the safety of all these artificial sweeteners. But so far, there are no severe adverse reported uh, um, side effects of all these artificial sweeteners
So in
that
fact,
I know of.
they're better compared to
No, I
sugars.
wouldn't say
Sugar.
they're better. I wouldn't
Okay.
tell you, and tell the public that it is actually better than sugar.
Mm-hmm.
But it is just an artificial sugar that people can try, but not to take it excessively. So
Okay.
let's say if I'm somebody who have been drinking 5 cans of Coke, I won't say that, oh, I still can drink 5 cans of Diet Coke every day. I'm not telling you that. Yep.
Okay, got it. So, so one of the biggest challenges is definitely the diet, and it's usually the sugar. If it's not sugar sweet, we're talking the sugar carbohydrates, right?
Correct.
Um,
Yeah.
yeah, that sort of thing. What's your advice for people with these challenges? What can they do to cut
Um,
it down? Is that
cut it
it?
down.
Okay, that's
Basically,
it. That's
cut
the
it
only
down.
solution.
But I just can't tell them to just cut it down. I have to
Mm,
tell them, okay, probably you can try with cutting down 20% of your rice intake. So instead of one bowl, maybe you take 80% of that one bowl and you start off
right.
with just 80%, and slowly, your stomach might
Lower
get
it.
used to it and you can lower it more and more.
Okay.
Yeah. So, depending on their sugar control, if let's say their sugar control is still bad, I'll usually ask them to, hey, come on, do better than that. Instead of 20%, okay,
Mm-hmm.
now it's time to cut down to 40% or 50%. Yeah.
Mm-hmm.
And
Okay.
it's not only rice, it includes noodles as well, kway teow, mee hoon, and all these things as well. Yeah.
Which is practically every single Asian dish, right? Yeah.
Exactly. Yeah. Yeah.
Yeah. I guess so basically what you're saying is cutting it down slowly, right? As opposed to drastic, because that or do you recommend the drastic thing?
Well, it depends on patient. Sometimes the if a patient is very motivated to change their lifestyle and they really don't want to get all these complications, if they're ready to cut down by 50%, by all means, go for it. But if it's only for those patients who find it real, a real difficulty cutting down their carbs, that is what I recommend, cutting down slowly by later. Yeah.
Okay, got it. When it comes to going back to our main topic, where diabetes linked to heart, by the time that you have heart disease within you, I mean, it's identified. Is it very hard to reverse? Are you too far along, or what's your take on this in your experience?
The take home message is that it's never too late. All right.
Okay.
Even if, on angiogram on table, we find the vessels are really horrible, we have we will fix it. And after
Mm-hmm.
fixing it, if you control your sugar levels and if within, good control of less than 7 HbA1c, I think your progression of the disease will be retarded.
Okay. Wow. Okay, cool. So it can be reduced. Okay, fantastic. There's a
Yeah.
lot of questions, so I would love to go into them. Let me just try and get the first one. Maple T saying thanks for the tips for year age 30 above, frequency of body checkup and category analysis that would really help them understand more. Sakina is saying in the Malay culture, there's this term tiga serangkai, which denotes diabetes, heart disease, hypertension. Are all these related? How?
Yeah, just now I mentioned a syndrome called metabolic syndrome, so which includes
Mhm.
diabetes, obesity, high blood pressure, this high cholesterol level, and gout. So if you want to cluster it, maybe it's not only Tiger Sarangkai, probably it's Lima Sarangkai. Yeah, so it's all in the same cluster of diabetes. And of course, if a patient doesn't have all this, and if they just have diabetes, of course, diabetes can lead to heart disease. But hypertension is a bit separated. Yeah.
Okay. Oh, a bit separated. Okay, got
Yeah.
it. So they move together. Okay. By the way, 14th of November is World Diabetes Day. I think that's why we're talking
Mhm.
about this, right?
Yeah,
Yeah.
yeah, correct.
Is there anything that you want people to know about diabetes and it's linked to, heart disease? Before I go to the next question, that they should
Um,
really know.
if you have diabetes, take your meds and cut down on your sugars.
Got it. Because definitely you can prevent and check early, right? At 30 years old.
Yeah.
Okay, Jaylin Ching is asking, may I know what type of heart screening we can do?
Basically, if you have no chest pain, what I suggest is a basic screening of doing an exercise stress test.
Okay.
But if let's say you have got some chest pain and you have got diabetes, perhaps you need to do something which is more sensitive to pick up all this coronary artery disease. I would suggest doing a CT angiogram.
Right. Okay.
Yeah.
The stress test, what can they tell us?
Stress test is basically doing an ECG, but when you do an
Mm-hmm.
ECG on a normal patient who is just resting, their heart is not stressed out, so we can't really get a lot of information from the ECG. We only get more information when the heart is going through certain amount of stress, when they're working harder, and they need more oxygen and blood supply to their hearts. So if there's narrowing in the blood vessels that supplies blood to the heart, and when you exercise, you need more and oxygen and blood. That is where we see all these changes on the ECG, and that is why exercise stress tests can actually detect coronary artery disease.
Right. Okay. Got it. Okay. Maple is also asking, can I check whether artificial sugar, such as brown sugar, dietary sugar, if it helps compared to white sugar, right? Maple,
Yeah.
for people with diabetes.
Brown sugar, white sugar doesn't really make a difference in diabetes. Like I said, artificial sugar will not contribute to your diabetes, but perhaps nobody knows that it might contribute to certain other diseases. Yeah.
Right. Okay. So it's still sugar. Sugar is still sugar.
Yes. Yeah.
Jasmine Yu is asking, what about low sugar Coke? Can we consume that if you have
Low,
diabetes? Yeah.
low sugar means you still have sugar, but it's just lower amount of sugar.
Okay.
I mean, if you have diabetes, what I'll recommend is if you really, really want to drink Coke, you might as well drink zero sugar Coke, like those
Okay.
artificial sugar Coke. Yeah.
Okay, so zero sugar Coke is the one you want to go for. Gwen is asking what kind of heart screenings would you recommend for diabetes patients on a yearly basis? Would it be different?
Um, no, like I said just now, if you have no chest pain, an exercise stress test would be enough for an annual screening for people with diabetes.
Okay, got it. Deva is asking, does Coke Zero really mean no sugar at all? Wow, yeah, now you're a Coke expert, Dr. Richard. Some of the
Why?
things you have
Because
to
I
do,
like,
right?
and Coke is my favorite drink as well, and I've
Oh,
been trying to cut
really?
down on it. Yeah.
Okay. Uh-huh, okay. So is it
Well,
really means no
yeah,
sugar?
Coke Zero means zero sugar, but in replacement of that is artificial sugar. Yeah.
Right. Okay, got it. And Maple Tea is asking, she understands from all age adults we should change from white rice to brown rice to reduce sugar level. Is that right?
You're right in a certain extent. Rice is still rice, but brown rice has got a lower GI or lower glycemic index. So the absorption of sugar in your body, if you take brown rice, is lower. So if you have to choose brown rice and white rice, brown rice is the way to go.
Wow. Okay. And we don't just have to wait until we're older. We can always start early, right?
Yeah, yeah, yeah.
Yeah,
Correct.
because
Yeah.
get used to the taste and stuff like that.
Yes, that's
Kyria
right.
is asking, can exercise actually reverse the diabetes and heart related issues? Can one become normal again? I actually know that answer, but I'm going to let you share it again.
Yeah, actually, Nina can tell you that it is irreversible. But exercise is a very good way to control the progression of diabetes.
Wow. Okay. So there you go. So there's no it's not reversible, but it can help control it, right?
Yeah.
Alexis Bong, I'm going to go to Alexis Bong's question before we go into the quiz questions. Yeah, so
Mhm.
Alexis is asking, does COVID-19 further damage to the heart for people who have been diagnosed with heart disease? This is a good question.
Yes, this is an awesome question.
Hmm.
Diabetes causes heart disease, yes, but COVID, the incidence of causing heart disease is low. It causes an inflammation of the heart, which is called myocarditis. So, it is not related to diabetes heart disease, but and also it's not related to coronary artery disease. It will just damage your heart in another different way, not by heart attack or what, but by causing inflammation of the heart. So in the long run, your heart will be weakened. So that's how COVID, that's what COVID does to your heart. But so far, I haven't really seen a myocarditis that is caused by COVID. Yeah.
Right. Okay. Thank you so much for that answers. Okay. What we're going to do now is keep having those questions come in. We're going to get to it in a bit, but before that, we have some awesome stuff for you guys to win, which are up for grabs. Okay. So it is quiz time, and as mentioned in the earlier part of the show, we've got a backpack, a flask bottle, and an umbrella up for grabs. And now is your chance. But what do you need to do in order to win? First, you gotta be sure to share this video out at least 3 times, and remember to set the share post to public so that everyone can see. Okay, and next, what you want to do is answer the 3 questions we'll be showing on the screen in a single line, single comment, and you'll be able to win the prizes. So let me repeat that: share the video out 3 times, and remember to set the post to public so everybody can see. And secondly, answer the 3 questions we're going to show on the screen in a single comment, and we will select the first 3 winners based on speed, the correct answers, and the shared post. So are you guys ready? Right? So let's take a look at the quiz questions. Right. Number one, if you have diabetes, that means your chances of getting a heart disease is 2 to 4 times higher. Is that true or false? If you have diabetes, that means your chances of getting a heart disease is 2 to 4 times higher. Is it true or false? Number two, all the following are symptoms of a heart disease: shortness of breath, coughing, swollen legs, feet, and ankles, fatigue. Is that true or false? All the following are symptoms of heart disease: shortness of breath, swollen legs, feet, and ankles, fatigue. Is it true or false? And number three, lastly, heart failure cannot be cured. It can be successfully treated with medications or surgery. Is that true or false? Heart failure can't be cured. It can be successfully treated with medications or surgery. Is that true or false? So remember, answer in a single line. Okay. Now, while waiting to hear who the winners are, let's get back to the Q&A. All right. So we have a question from, okay, continuing Deva's question. Does consuming red rice or brown rice really help to lower down blood sugar level? It does, right? I think we
Yeah,
answered this earlier.
yeah, we did. Yeah,
Okay, because of the
because the
low.
brown rice has
Mhm,
got a lower glycemic index, so the absorption of sugar is lower if you take brown
mhm.
rice compared to white rice.
All right. Thank you, Deva. Sharifa Majida is asking, does antihypertensive medication like Hyza, I'm probably pronounce it wrong, can cause diabetes?
No, Hyza is actually a combination of two medications in a single pill, and these two medications will have no effect on diabetes.
Okay. No effect on diabetes whatsoever.
Yeah.
Annie Chong is asking, if a woman have gestation diabetes, isn't she confirmed that she's going to get diabetic in the future?
No, if you have
Hmm.
gestational diabetes, after you have given birth, your sugar level will go back to normal. But
Okay.
you are just at an increased risk of getting diabetes later on in life.
I see, because you have it in you. Does that
Correct.
mean these? I'm going to ask a continuation question. If you get pregnant again, does that mean you're going to get another round of
Not
gestation
necessarily.
diabetes? Not
No, not
necessary.
necessarily. Yeah.
What does that depend on? Yeah.
I think there are just changes in the body, physiological changes in the body, and everything goes haywire when you're pregnant. So probably sugar is one of those things. Yeah.
Right. Okay. Got it. I just assume that every pregnancy you're gonna it's like a seasonal diabetes.
Yeah,
My
perhaps.
bad.
Yeah.
Okay. Nareen Daliwal is asking, what about family with history of diabetes? What should I do to be more careful?
Yeah, that's a good question. If you've got family history of diabetes, you need to do checkups earlier. Probably even if you're not age 30 yet, if your family has like, got diabetes, maybe you can do a checkup even before the age of 30. Yeah. So at least you
Mhm.
know if your sugar is on the higher side and it's like a borderline diabetes kind of thing, then you might need to do more routine or frequent checkups.
Right. Okay. Got it. Maple has a very good question. She is actually asking, my father and grandmother is having diabetes, where it is very sad that my grandmother had to amputate her leg. Currently, I'm having 1 year once blood checkup for diabetes. Is it good enough for early detection for diabetes? By the way, she is 39.
39, yeah. As I mentioned just now, if you are less than, if you're more than 30 years old, you should be getting an annual blood check of your diabetes. I think, like I said, if your blood check is not borderline and is low, you don't really have to go for frequent blood tests. But for you, I think Maple, the list is just once a year. Yeah,
Ah, okay. So once a year is good enough, yeah? So she's
yeah,
basically doing the right thing, yeah, doc?
she is. Yes,
Okay,
yes.
good job, Maple. Okay, William Tunggadi is tuning in from Indonesia. Hello. Saya ada kenal bapa 64 tahun, dapat diabetes 25 tahun, minum obat diabetes Glimpride dan jalan di Taiwan, dapat serangan jantung dan berobat di Taiwan University. Pasang stent 3 dapat serangan jantung lagi dan pasang ECMO dan mati kerana sepsi. Kenapa bisa walaupun sudah minum obat dapat diabetes dan sudah berobat bisa mati? Did you get that
Alright.
question, Doc?
Yeah. Yeah.
Okay.
I think bila you makan ubat, tak semestinya diabetes tu ada dalam kawalan. Ada kalanya ubat yang you makan tu tak cukup kuat untuk kurangkan paras gula dalam darah. So sebab itu dia akan mengakibatkan lagi kerosakan dalam saluran darah jantung. So that doesn't mean if you're on medications already, your risk of diabetes is going to be low. As long as if you're on medication, whatever matters at the end of the day is to bring your sugar level down. Sometimes, like I said, progression of diabetes is a one way. It just gets worse and worse. Sometimes if
Mm-mm.
you're on one type of medication, it might not be enough. So you go on two types of medications. So like two types of medications after a few years, it might not be enough because of diabetes. Your diabetes is getting worse. So you may need three
Right.
types, and
Okay.
eventually you may go on insulin. So some
And
people just have this
also,
misperception that oh, they're already on medication, so I should be fine. I don't need to do my blood check anymore. I can just buy medications from the pharmacy and monitor myself. So that is a wrong way of going around it. And so
Okay.
I think that is a very good question that he has
Yeah.
asked us earlier.
Terima kasih ya, William. So basically, we also need to check, are we doing anything to our food intake? How are we taking care of it, right? So it's not
Yes,
just the meds, it's also your lifestyle as well, which is very important. And
correct.
as Dr. Richard mentioned, it's a progressive disease. So you need to check to see whether the medications that you're taking is good enough or you need more, right?
Yeah, correct.
Okay, cool. So all the questions are coming in. Hang on. If you makan William's next question is makan banyak nasi putih dan roti bisa dapat diabetes. Apakah jenis diet yang bagus? Apa nama dietnya supaya terbebas dari penyakit dan panjang umur? I think this is a great question. Just to
Yes.
be, to maintain healthy lifestyle in the long term.
Yes. I mean, the best diet to go on is diet with fruits and vegetables. Yeah. But how many people can actually go on that? So, like what Maple was saying just now, she was asking a question of whether white rice is better than brown rice. I think that is a very good start. If you're a rice
Mm-hmm.
person, maybe you can change your white rice to brown rice. So that will put your sugar level down a bit.
Okay. So basically, it's about looking at our lifestyle. What is it that we're putting in our mouth, and finding healthier substitutes, right?
Correct. Yep.
Yeah. So like people take cauliflower rice. I don't know if that's good, and they replace rice. So it's about getting reducing it, and I guess it's a complete lifestyle change, right?
Yeah, you're correct. And just remember
Mm.
that everything that is brown is better than anything that is white. I mean,
White and
in terms of
processed,
food.
right?
Yeah, yeah.
Yes. Okay, cool. One last question before I announce the results. Any difference of heart disease symptoms between men, women? How do we differentiate muscle strain and heart attack? That's a good question.
Yeah, thank you, Sakina, for your wonderful question. I think it is an important thing to know. The first part of the question, is there a difference between men and women in terms of the manifestation of the symptoms of heart attack or heart diseases? Yes, I would say men usually they have more typical symptoms, meaning they will have like a deep crushing central pain, chest pain, and they come in and true enough, it is a heart attack. But females, they tend to, females are they tend to have more atypical chest pain. So sometimes they can just come in with some, dizziness, some shortness of breath, some lethargy, or some vomiting. But when we do an ECG, we find that, hey, you're actually having a full-blown heart attack. So that is the difference between men and women. And
Mm.
of course, diabetic patients also fall into that risk of getting a silent heart attack, right? So not
Mm.
necessarily if you have no chest pain, you're not having a heart attack. Last month, I had a patient who walked into the ER with vomiting, with low BP, and she was just vomiting profusely. But when asked, she had no chest pain. But when we did
Mm-hmm.
an ECG, she had a full-blown heart attack. So we sent her straight away to the cath lab, and true enough, there was a vessel that was 100% blocked, right? So
Wow.
the second part of the question, how to differentiate muscle strain and heart
Yes.
attack. Yeah, that is a very good question. A lot of people come to me for chest pain because whatever chest pain it is, the first thing you want to rule out is actually a heart disease or heart attack.
Mm-hmm.
Right. The nature of a chest pain that is from a muscle strain is usually sharp in nature, and it is localized in one area. Okay. And most of the time it is worsened by movements. Okay. As opposed to a heart attack kind of chest pain, a heart attack chest pain is more deep seated. It's like more
Mm-hmm.
crushing, and it's associated with other symptoms like you have cold sweat, and sometimes the pain goes up to your neck, or it
Mm-hmm.
goes down to your arm, and you feel a bit numb on your left arm especially. So that is how you differentiate between the two type of chest pains.
I
Awesome
see.
questions.
Okay.
Yeah.
Yeah, yeah. Amazing questions. Okay, that's another amazing question from Jasmine Liu. Can we consume honey? Honey is sweet, can cause diabetes, but honey is also good for health. So which is it?
Yeah, I
This
think
is a
that is a good
question from
question
Jasmine
too.
Liu. Yeah,
Yeah,
yeah.
the the problem with honey is that we are usually not sure whether it is an original, authentic honey or not. Because in the market there are many types of honey. So those expensive, authentic honey, by right, it should not affect the sugar level. but a lot of not so pure honey, they tend to add sugar inside as well.
Mm,
So that is
right.
the thing that you need to find out, before you consume the
So
honey.
pure honey is actually good. It's just the ones you got to check whether they include sugar in it. Yeah.
Correct. Yeah.
Yeah. Okay. Najwa is asking, adakah seorang pesakit diabetes boleh sembuh sepenuhnya dari penyakit ini dengan menjaga pemakanan? I think we got that answer. The answer is no. Yeah, Doc.
Yeah. Yeah.
Okay. And boleh ke sakit buah pinggang di reverse? Sakit buah pinggang is which one? Uh, oh, sampai tahap perlu belum sampai tahap perlu dibuat dialysis.
Okay, that's a good question, Wiens. Um, if a patient has got kidney failure because of diabetes, and it has gone to a stage where they already, at the stage that they need dialysis, impossible that it's gonna be reversed back to its original function. Even if you control your sugar at that time, it will be too late. Like what I said just now, if you feel it already, like you have symptoms of renal failure, it's a bit too late to reverse it, because at that time there's only one thing to do, and that's for dialysis.
Right. Okay, got it. There's another fantastic question from William as well. Apakah kalau orang vegan and vegetarian ada effect something negative? Actually, I would also like to add to this question. If you're vegetarian or vegan, does that mean you don't get a heart attack? I mean, you don't get heart disease?
If you're vegetarian or vegan, but you're
Uh-huh.
smoking 2 packs a day of cigarettes,
Yeah.
you will still get
And
heart
not
attack.
all vegetarian food is healthy, right? Because they could be loaded on carbs as well, right?
If it's pure, yeah, yeah. I mean, if you count,
Yeah.
put into account the carbs that is inside, of course not. Yeah,
Because a lot of vegetarians I know are big.
maybe.
The ones I know. Okay. Anyway,
Right.
so basically, if you're vegetarian or vegan, does that mean you do not get heart problems?
No, like I said, diabetes is just one of the risk factors for getting heart disease. So
Mm.
if you're very, what you call it, a disciplined person who doesn't take carbs at all, and you're taking full on fruits and vegetables, your chances of getting diabetes is low. Yeah. And
Hmm.
but if, like I said, if you have no diabetes, but you've got high blood pressure, you've got high cholesterol, you are a smoker, your chances of getting heart disease is still there, right?
Hmm.
Irregardless, even if you do not have diabetes.
Right. Okay. Thank you so much for answering all the questions. I think let's go into the quiz so we know who are the winners. So first things first, let's get the questions answered. So for number one, if you have diabetes, that means your chances of getting a heart disease is 2 to 4 times higher. It's true, right, Doc?
Yes, very true.
Okay. And all the following are symptoms of heart disease: shortness of breath, swollen legs, feet, and ankles, fatigue. Is that true?
Absolutely
Definitely true.
right.
Okay. And lastly, heart failure can't be cured. It can be successfully treated with medications or surgery. That's also true,
That's
right?
true. Yeah.
Okay, great. And the winners for the quiz is Nareen Daliwal, Jasmine Liu, and Maple Tea. Congratulations.
Congrats, guys.
Woohoo. For listening to Dr. Richard, right? For getting it right. Well done. Okay, cool. Now, congratulations to all our winners. Congratulations to all the winners. Don't go anywhere. We will be contacting you after this within a day to get your details. So make sure you guys check your FB Messenger inbox because we're going to send you the details there and make sure you reply. So, well, there you have it, ladies and gentlemen, a really insightful session with Dr. Richard. What was some of your biggest learning from today's episode? Let us know in the comment. For me personally, I did not know that you could not reverse diabetes, and that it was a huge silent killer, almost as big as cancer. And in fact, a lot of it was asymptomatic. So that to me is scary. So and the easiest way, I guess, is to do your blood check if you're 30 and above. That was the biggest learning that I got. What about you guys who are tuning in? We've got so many thanks from Maple, Jasmine, Si Ying. Thanking you, Dr. Richard, for everything that you shared. I think one last questions before you go, right, Doc? I would love to know, um, what final three tips would you give to people or caregivers who are taking care of their loved ones, with diabetes? Because it all starts with diabetes, right?
Yeah, yeah.
Mm.
Um, Number one, I think people need to realize the severity of diabetes, and especially if you're thinking of your loved ones with diabetes, always make sure that they have got a good diet. Always make sure that they do a lot of exercise or regular exercise, and always make sure that they are compliant to their medications as prescribed by the doctors. And if they have got a follow-up appointment, do go for it, and not just go to the counter and buy some medications, because these patients need regular blood tests and follow-up. Yeah. Of
Mm.
course, more importantly is you know enjoy life, and then don't be, like I said, you can't just stop all sugars. Once in a while you can treat yourself to some nice cakes. Once in a while, diet coke perhaps. Yeah.
Okay, got it. So there you have it. So basically, find out. I think number one, definitely accept it. Find out what's possible for you, and definitely exercise and make a lifestyle change. Life is still possible. You can have fun and treat yourself once in a while with that diet coke or with that
Exactly.
cake and
Yeah.
sugar. Yeah, it's not a death sentence, right?
It
I
is
think
not.
it just
It's not.
means, yeah, I think it just means you need a lifestyle change, and
Correct.
yeah,
Correct. Yeah. I think
yeah.
if you have diabetes, it's not a death sentence. If you
Hmm.
keep your sugars under control, you will have a good quality of life. You'll be
Yeah.
free of all these complications of diabetes. Yeah.
Yeah, I mean that is what we all want, to have a healthy life, right? And that healthy diet will help get you there, as opposed to being
Correct. Yes.
sluggish and dragging yourself, especially where obese, right? That sort of thing.
Yes.
Right. Well, there you have it, ladies and gentlemen. I learned a lot. So thank you. A huge thanks to Dr. Richard. We definitely learned a lot from you. Thank you so much. So let's give Dr. Richard a round of applause, shall we, before we
Thank
say
you so
goodbye?
much. Thank you, Nina, and
All
thank you
right.
everybody for tuning in. See
Okay, we'll
you.
let you go now. Thank you. Bye.
Okay. Bye.
Okay. Well, there you have it, ladies and gentlemen. Super insightful session indeed. Absolutely loving what you guys, that all of you at home are getting tremendous value from today, as well as based on your feedback question. Jasmine is saying life is beautiful. Yes, it is. Seeing. Thank you, Dr. Richard. Very informative session. Yeah, thank you so much. Thank you. And Stephen as well. Thank you. Well, I hope that was very useful for you. Unfortunately, that's all the time we have for today. But if you know someone who will really appreciate the tips, the insights, the information from today's episode, please share this video out. Tag them, because you never know who it's going to make a difference to. And in this case, it's not just making a difference, you could be saving somebody's life. People need to know about how that it is a big deal, this diabetes thing, and we need to start checking to create an awareness about it. All right. So make sure you give us a like and lots of love while you're at it. Thank you again. Till then, take care of yourself and each other, and we'll see you in the next episode. Okay. Bye.